right, our next panel is going to touch on healthcare's inflection point and the role that technology plays in the space. Let's welcome to the stage Cunningham, Chief Medical Officer at Providence, Nwando Anyaoku, who is the Vice President and Chief Health Equity Officer at Swedish, and the session is moderated by Theresa, who is the Managing Director of Clinical Solutions at Tegria. Thanks for joining us for today's Sponsor Lunch. Thanks for being here. Welcome.
Can I have that water?
All right, thank you. So just as a reminder, I'm Theresa Demeter, one of the managing directors with Tegria, and with us today we have Nwando Anyaoku, who is a pediatrician and the Chief Health Equity Officer for Providence, Swedish, and Cunningham, Chief Medical Officer for Corporate Partnerships and Telehealth for Providence. So nice to see you both. Looking forward to a good conversation. You know, just today I saw Gallup poll released a survey that said 44% of Americans would rate our healthcare system as poor, and that just came out this morning. And our topic today is that inflection point of healthcare, and how will we move forward, and how do we utilize technology and all of the minds in the community to help us move forward. So let me start there and ask you, obviously we've been hearing that healthcare is broken more and more, especially in just the last few months. Where are you seeing some of the most significant pain points right now in healthcare? Evie, why don't we start with you?
Yeah, I mean, I think it's at an inflection point in healthcare in the sense that there's a lot of opportunities for us to improve the experience, but there's just so much manual administrative work that I would say is one of the areas where I think it's manual and administrative work for the patients, it's manual and administrative work for the clinicians and the caregivers that are on the front lines, because we have just a lot of, the technology exists, but the technologies are all disparate and they don't talk to each other, and it creates a very disjointed and cumbersome workflow. So I would say one of the biggest opportunities that we have from a technology perspective is to streamline that. And there's a lot of efforts going on to do that, but it all doesn't fit together quite yet. So I think we're going to see a lot of innovation that's going to happen in that space over the next 5 to 10 years, but it'll be messy in the process.
Yeah, absolutely.
I think that healthcare is so challenging because it's so expensive.
Yeah.
It's been built like very expensive. It's not designed really to serve people who can't afford it. It doesn't have opportunities to improve access. And so, you know, we're dependent on this employer-based model, which is great if you have an employer, and if you're not paying attention to how much your portion of the bill is steadily increasing. But more so, those who don't have the access to that are particularly challenged. And we've built this Rolls-Royce space rocket model of health, which is great if you have that rare condition that nobody else can manage. But the everyday, you know, managing chronic disease, keeping people well and healthy, avoiding those bad outcomes is really not well defined. And as the pandemic has shown us, there are large subsets of the population for whom it just doesn't work at all. Their access, their experience, their outcomes are significantly you know, deficient relative to the majority population. So there's just so many ways that we're struggling at the moment. And you know, thinking about how we do these things better, we keep trying to retrofit a bad model. So we add layers and layers, and all it does is just make it more and more complicated and challenging for everyone. So yeah, I would say we're certainly at an inflection point where we have to come up with a solution, because this can't go on.
So in the comments that you've just made, I hear a lot about health equity and creating access to healthcare and making sure that everyone has the same type of access to healthcare. How does technology move us forward in that regard?
Yeah, so I would say like we have to have technology intersect with our ability to broaden access and stretch especially clinician capacity. We have a shortage of physicians and providers in the United States, and that shortage is just getting worse every day. As more and more patients age into the Medicare patient population, as more and more clinicians, just from burnout, being exhausted from what happened during COVID, we don't have enough staff for our clinics. We don't have enough staff for our hospitals. And we have to make every single visit with a clinician count, be the most productive visit that it possibly can be, because there just is not enough of us. And the ways that we can do that is with technology, with being able to augment and enhance our clinicians on the front lines with the best information, with the smartest EMR systems, with the most efficient workflows that they can possibly have, so that they're not running around doing stupid stuff, which we really actually do have like a Stop Doing Stupid Stuff task force in the medical group I used to run. I mean, it's ridiculous, some of the things that we're doing. And the same thing with our caregivers, with our nursing staff. We have to make sure that we're optimizing their ability to work at their highest level of capacity, and we also have to find ways to connect them, which is why telehealth, the possibilities with what you can do with telehealth and virtual care are so compelling. Just to give an example, we have a telestroke service at Providence where I work, and we have 100 hospitals at night covered by our telestroke program with 2 neurologists. So if you can imagine the capacity that we can stretch with 2 clinicians across 100 facilities because of telehealth, those are the types of things that we're going to need to do to be able to meet health equity needs.
I think about the whole scope of health care, health beyond healthcare, right? So how do you keep people well? How do you give people information where they are, right? So before you get that sick where you have the stroke, how do you get diagnosed with your hypertension and get that managed? And if you're in a rural area, if you're from an underserved population in the urban space, if English is not your first language, what are all those barriers along the way, and how can technology help bridge that? I think the presence of technology really represents the best of times, right, and the worst of times. We have the opportunity here to scale interventions that can bridge the gap between the intention of the healthcare system and the ability of the people you're trying to serve. So if you have communities for whom English is not a first language, how wonderful to be able to use technology to bridge that gap. If you have people who can't access healthcare readily because they don't have those channels, you can expand those channels through technological, resources. And I love to say the word technology because it means all sorts of things, and that most people in this place know better than I do. But as we think about health equity and we think about things like, pregnancy and birth outcomes, right? So we know that African American women, for instance, have 4 times worse mortality and morbidity from pregnancy than their white counterparts. How can we understand that? How can technology help us identify the drivers, give the resources to bridge those gaps so that we don't have such a disparity in such a wealthy country, that people should expect that they could have a pregnancy and come out whole? But the worst of times is that if you're not intentional about how you develop technology, you can actually worsen those disparities. If you build it without awareness or intentionality about understanding different groups, if you don't have diversity in the people who are building it, you might find a situation where you're actually worsening the gap. And so as we're building technology, you should have health equity as part of the design, because otherwise you can actually make a bad situation exponentially worse. If you think, somebody was showing us a coffee machine that's AI-driven. If you think about how AI and machine learning can just change the landscape in a minute, if it changes it in the wrong direction and it takes it away from those people who it doesn't recognize, you can make a bad situation significantly worse. And so I love the opportunity, but I feel like it's really important to call out the risk and that we are paying attention to that as we're going down this road.
I think that's a really good point. And this is a room full of people who love technology, but I think about there's technology from the provider side, and then there's technology from the patient side. And I think about my mom, who's 89 years old, has arthritis in both hands, doesn't quite understand how to use her cell phone. How do we, with this idea of equity and not leaving anybody out, utilizing technology to improve access, how do we really ensure that if English isn't your first language, if you have arthritis in both of your hands, if you don't have access to the internet, how do we not leave people behind? What are the steps we need to take to make sure that we're not widening that gap?
Yeah, and I think, I want to piggyback on everything that you said, and I think you're bringing up that health equity by design concept that's so important. I mean, tech literacy there's a continuum, right? And when we think about some of our most vulnerable patients, yeah, maybe everybody has a cell phone, but maybe it doesn't have a lot of data, or maybe their cellular service is choppy in different areas, or they don't know how to do the automated, password saving and things like that. And so we have to meet patients where they are. And there's a lot of solutions. We intersect and interact with a lot of different vendors and tech companies that are up and coming in healthcare that are building solutions. And a lot of times when you're looking at some of these solutions, they're innovative, they're cool ideas, they solve a problem, but there's a lack of understanding of kind of workflow and then also sort of the patient population that we interact with, and the fact that there's so much diversity there and that we have to figure out a way to meet people where they are. So as we design solutions for our patients, and as we're thinking about how technology is going to be able to advance in that space, we have to make sure that we build in the health equity by design, and that we're really kind of designing the solution around the people that are going to be using and iterating upon that.
And I think how do you do that most effectively is to ask them. Ask them what they need. Ask them how they're currently solving their problems. Because one of the things that we've done historically is to sit and we're really passionate about how we can solve people's problems, and we think, I know, we're going to do that. And then you build this really shiny object and they look at you like, what are you doing? It's important to really harness the wisdom of our communities. Our communities will tell you what they need. They will tell you how they have typically solved the problem. So while we're thinking about technology as this big vehicle, the human face, the stories, the connection to the community, understanding what each community needs from you. And that's what makes it actually particularly special, because every community has a different need. They have different resources. They have historical ways in which they've solved their problems. And they have ways that they'll tell you, if you just did this, this would help me out, rather than you creating this other thing that's not particularly helpful to them. And so I always say, nothing for me without me. Have a conversation with me, right? So that I can tell you what my needs are and how you can help me. I think about when the COVID vaccine was first available in Seattle, and I love Seattle, but it was super sexy, right? We had the link, and you had to refresh, and you had to find a teenager. If you didn't have a teenager or someone who was tech savvy, you're like, well, okay, this is great, but how do I get there, right?
Yeah.
And so one of the things that we did was to think, okay, we're going to have to partner with community-based organizations who know the people who are at highest risk, for whom this really shiny link is not going to work. And so we got a mobile van, and we took vaccine out to the community. And we said, here we are, we'll work with people who typically you've already built trust with, and I'll come back to trust, but you've already built trust with, and we can serve you in the way that is impactful to you, as opposed to some big scale solution that is not really relevant to everyone. Trust is key in this journey, right? Healthcare and health tech moves at the speed of trust. And there are communities, especially minority communities, for whom the healthcare system has not been friendly. And therefore, that trust must be earned, and it must be jealously guarded. And so we have to figure out, how do we prove ourselves trustworthy in having this conversation with these communities, to ask them what they want of us and how we can serve them and be true to that trust that they've given to us. So when we go out into the community and we partner with community-based organizations, we're piggybacking on the trust that has been built with other community-based organizations. How do we do that at scale? How do we expand that connectivity to our communities? Those are the things we have to think about at this inflection point if we're to arrive at a more sustainable future.
So I guess one of the questions I would have for you then, it sounds like you did a community partnership. So within healthcare, hospitals take on a lot of that responsibility. What is the hospital's responsibility, and where does healthcare really need more community partnership to scale and make sure that we're not leaving anyone behind? Where does that line kind of start, where this is the hospital's responsibility and this is where healthcare needs more help?
Well, I mean, and I kind of go back to the point that I made previously. You have to, a hospital is part of the community. Whether or not they want to say, well, we just have beds and we only manage the patients that come in and out of the beds, that's just not the reality of it, especially not in Washington State, where we do not have enough beds. Every single hospital bed is a scarce resource, and if you can't help manage the throughput and the flow of what comes in and out of your hospital, you'll be completely inundated. And so you have to invest in that community partnership. I mean, not to say that they also want to, like hospitals want to invest in that community partnership, but it's also really important so that you can actually meet the needs of the community. So there's definitely a symbiotic relationship there. That being said, I mean, there's a lot of community organizations, and they bring a lot to the table in helping to support. So I think these coalitions or these alignments of different community-based organizations with the health systems are really critical to the long-term success of that, because the hospitals can't do it alone. They can't be responsible for the health and welfare of every patient that's out in the community. They just don't financially have the ability to do that as much as they would want to. So it's important for it to be done on both sides, but on the flip side of that as well, I think there's also a ton of opportunity for the technology community to engage as well in that, because there's only so much you can do from a community outreach perspective with the limited resources that you have to do that, and the same thing with the limited resources you have in a hospital. So if you can bring that together with building out technology solutions that really streamline and integrate those capabilities, I think that you can meet a lot more needs within the community if everybody's sort of aligned and working towards the same goals in that process.
I absolutely agree that the hospital is part of the community. I think the inflection point we face in healthcare really speaks to the fact that this is a public health crisis. The public all needs to be involved. So if you're thinking about problem solving in public health, it involves engineers, it involves attorneys, it involves everybody. Right. Bringing their perspective to bring the solution to the problem that we face. So in the last couple of years, with the advent of the syndemic, right, the dual pandemic of COVID and racism as a function of people understanding that as a public health crisis, multiple organizations across this country have identified the need to focus on health equity. A number of these are tech companies. So, Google has a whole health equity department, IBM does, and I'm sure a bunch of other organizations that you know better than I do. Law firms have health equity firms, right? So everybody is saying, what is my piece of this pie and how can I contribute to solving the problem? Because the hospital is maybe the final destination where people finally land when their health has completely collapsed. But there's a whole lot of antecedents to that. Mm-hmm. And who can, have a part in that journey to keep patients healthy as long as you can, to keep them at home safely as long as you can, to manage the things that you can manage at home, in partnership, so that we're thinking about the whole thing as one ongoing ecosystem, as opposed to, well, there's the hospital who's responsible for healthcare or the clinic who's responsible. That's not the way it works, because healthcare is a complete social, mental, physical, all of it. And all of us have a role to play. And so the ask is, in whichever corner you have agency, how do you have a role to play in this journey? What can you bring to the table? Do you control information? Can you make sure that information that patients have is trustworthy? Do you control access to insurance material? Can you help with health literacy? What can you do wherever you are? Can you help with financial models that allow people to pay for ongoing health care or fill their prescriptions? everybody has a little piece of this that they can take on. And so we have to think about it as a continuum, and how all of us can influence, this new direction that we must design for healthcare.
So kind of going back to something you said, Evie, providers are kind of a precious commodity at this point, right? We don't have enough. The pandemic has been tough for everybody, nursing and physicians and everybody, and so we're seeing people leave the profession. How can we utilize technology to either, as you started to talk about, expand the capacity of providers, or to make life easier for providers so that they either are drawn to the profession or they don't leave the profession?
Right. Yeah, there's so much opportunity, I think, to improve the experience, both for caregivers. I don't want to undermine also how frustrating it can be even if you're not a physician or an advanced practice clinician, but just being a caregiver on the front line. There's so many opportunities to streamline. I think, and there's so many opportunities for technology to streamline. I think what's happened, though, is there's been a lot of either pointed solutions that have been developed, or solutions that fix one problem that maybe isn't available in the EHR, but then the actual technical lift of weaving those pieces together and integrating into the workflow is extremely complicated. So there are lots of things that I tell people to think about. Workflow optimization. So some of it is just a matter of just optimizing what you currently have and being able to use it in a smart way. And some of that has to do, not all of it is technology issues, some of it is just how do we train people to use this the right way? How do we, the change management piece, how do we get them on board and engaged and feeling comfortable with doing something differently? Because we are creatures of habit. Then there's pieces around automation. There is so much opportunity for automation in healthcare, and we have literally scratched the surface. I mean, there is very little automation in the EHR. There is very little automation in some of the front end and back end. There's technology that exists that can do it, but it requires people to sit down and build the logic. It's not as easy as just turning on this switch and all of a sudden you have this automated process to check people in. It takes a ton of work to actually build the logic to do that. The same thing with clinical logic. When I go into the EHR and I'm seeing a patient.
Does everybody know what the EHR is?
Sorry, the electronic health record. When I go into the electronic health record and I'm looking into a patient's chart for the first time, now with all of the abilities to connect electronic records across multiple health systems, I might go into a patient's chart and there could be 4,000 pages of information. If the patient's been in the electronic record for 10 years, 4,000 pages and pieces of information through their history. I don't have time to read through 4,000 pages in every single chart for every single patient, and most patients these days have that much information in it. So how do we help our clinicians surface the information that's pertinent to them during that, pertinent for them to see and understand about the patient in a nimble and quick way? And it's we have the technology to probably do that, but that's not the experience that clinicians have today. We're still wading through piles of information, looking for needles in haystacks. And then, again, there's also opportunities to connect people more nimbly. I talked about telehealth, the 100 hospitals that we have on the telestroke service. That is not a streamlined, easy-to-use technology solution. And it has a lot of fragmentation today that requires a lot of manual work. We make it work, but there's a lot of opportunity for us to make that smarter, faster, with integrations, with single sign-ons, with automations, and things like that. So
sounds like something someone here might be able to help you with.
Yes, exactly. So that's what we have in front of us, I think, because we won't be able to scale without those types of solutions.
And I think that, as one who, in the course of my career, has gone from paper to when we were actually building electronic records, putting the bricks together, basically trying to get technology to replicate exactly what we did in paper. And it just doesn't work that way, right? Because it's a whole different way of practicing. But what that's done is things like, I look in the chart and I have 4,000 pages. Well, according to the record, I have access to it, but how can I find it? So now I'm responsible for information that I can't find, right? And so as we're thinking about how do we make, and so physicians who are ultimately, you're the one, your license is on the line for that patient. So that's an incredible burden trying to figure out how do I know what I'm supposed to know for this patient? And how does technology make this easier or make it more workable for me? And I think part of this is in the development of any new technology is really paying attention to the voice of the customer. Who is using this thing and how are they using it? Because I will tell you that when you talk to 3 or 4 physicians, the third person in will tell you, they keep throwing this stuff at us and we have to learn it. And nobody asked me how I would use it. And my patients don't really care how the electronic record is designed. They have a different set of issues, and their particular issue doesn't necessarily crosswalk. So how are we intentional about integrating the voice of the customer in developing electronic medical records? And how are you intentional about having a diverse customer? Because having diversity in your clinical workforce is also important to developing technology that works much more broadly and more equitably, because there are things that are shortcuts for me that would not be for Dr. Cunningham, right? So each one of us has to do different things to figure out how we navigate the care of our patients. And so having diversity in the customer as well as the developer is really important as we think about building this new ecosystem in a way that is useful and sustainable to the clinicians as well as to the patients and community.
Yeah, I just want to point out, because we talked about the 4,000, pieces of information that's in the chart, and I talked about automation, but there's also the AI and the machine learning components of, we have tons of data out there. There's so much data. There's patient data, there's hospital operations type data and analytics and things like that. We're so overwhelmed with data, okay? And as a clinician on the front line, I don't want to see another dashboard, okay? I need to know how to work smarter, okay? Stop creating dashboards, because there's probably 500 of them, different ones that I could look at. What do I need at the point of care that's meaningful from a data perspective so that I can help my patient and I can get through my day more easily? And so those are the things when you think about data. We have a lot we can learn from data, but the delivery model of how you bring that to the point of care and actually have a meaningful impact on changing a decision of what a clinician might do, that is a much more difficult thing to solve.
Well, in our last couple of minutes, I think you just really hit on a good way to close, thinking about the creative technology minds that are in this audience. As we think about healthcare, sometimes it has a reputation as being a tough field to enter and a harsh market for outsiders. But how can the people in this room help mitigate some of the problems that technology brings up, and then how do we also ask for their ideas and thoughts on how to continue forward?
I think we just ask. I think we build connections, right, to have the conversation so that the developers or the incredible minds who are designing all these really exotic things are working with those who are on the front line. Because otherwise it doesn't work. And they do, right? If you ask them, they're going to tell you that, of course, we work with the people on the front line, but you work with these people on the front line. So how can you get a wider scope of what is out there and who really needs what, so that when you come up with whatever your minimum viable product looks like, you've got input from a wider scope of people who can tell you that this is useful, this is, this is more valid. So I think the answer, which is always my answer, is communication and connections and really building those bridges.
And I would echo everything you said. I think that when you bring clinicians and technologists together, that's really where the magic happens. That's what our CEO, Rod Hochman, usually says. And I would say that, Providence is a very innovative and forward-thinking healthcare system that has invited in a lot of different technology partners. We have Tegria as our partner company as well. And we have been able to do some really interesting things because we've said, hey, here's a group of clinicians, let's sit down and in an agile way iterate on some solutions together. And I think that's when you put in that commitment from the technology experts, computer scientists, engineers, and the clinicians or the frontline caregivers, you bring them together and you have them really design a solution together. I think that's really where the money is, and that's going to be key.
Perfect.
To success.
Perfect ending note.
Yeah.
All right, thank you.
All right.